Good morning everyone. I am Gayatri. I am working in SMS College of Nursing. I am a nursing lecturer. Today our students present pyrexia conditions.
From Coimbatore and what first floor, date of admission 9/10/25, admitting diagnosis fever since 3 days, then single source of information patients and case sheets, then present medical history, Ms. Pratiksha 16 years old, admitted with complaint of cough, fever for 3 days and present complaint signs and symptoms, cough, fever, loose stools. She is conscious, oriented, her vitals are temperature 100 degree Fahrenheit, pulse 72 beats per minute, BP 120/60 mmHg, respiration 18 beats per minute, and present surgical history, there is no present surgical history. Past surgical history, there is no past surgical history. Personal history, Ms. Pratiksha has good hygiene practice. She takes baths daily. She has normal bowel and bladder elimination pattern. She voids 2 times per day and passes stools regularly. She sleeps 1 hour in a day and 8 to 9 hours at night. She has no history of smoking alcohol, chewings, and she has hobbies like playing indoor games. And menstrual history, Ms. Pratiksha attained menarche at age of 12 years. She has regular menstrual cycle. She has no history of premenstrual symptoms. Then family history, Ms. Pratiksha lived in a nuclear family. There was no recent death in the family. There is no history of hereditary disease like diabetes mellitus, hypertension and all.
Head to food examination. Ms. Pratiksha general appearance, nourishment, well nourished. The activity is active. Posture normal posture. Body movement normal walk. Mental status level of conscious. She is conscious and oriented to time, place and person. Her memory status will be good and his BMI will be normal. And vital signs will be checked. Her vital signs temperature will be increased because of she has in the pyrexia. Temperature will be 100.9 degree Fahrenheit. Pulse 1 or 2 beats per minute. Respiration 18 breaths per minute. Blood pressure 120/60 mmHg. Next, skin color. She is dark in complexion. Moisture, she is good moisture. Texture and thickness, she is smooth texture. Hair color is black in color. Texture is silky in texture. There is no lesions is present in her hair. Nails, her nail shape is normal. Color is pinkish in color. Head and face, size and shape of skull generally rounded. Symmetrical in shape. Scalp is cleanliness. Face is pale in mild headache is present. Eyebrows will be normal in both sides. Eyelashes is equally distributed in both sides. Eyelids is absence of discharge in both sides. Sclera is white in color. Pupil is normal. Eye muscle is normal. Eyeballs is normal in both sides. Conjunctiva is pinkish in color. Next, ears. Inspection. Size and shape of ear is normal in both sides. Discharges, there is no discharges in both sides. Tympanic membranes is normal. While palpating, there is no tenderness will be present. Hearing acuity, eardrum, Rhines and Weber's test will be done. Here voice test, tuning fork test, whisper test, watch stick test will be done. And next, nose. Inspection, external nose is symmetrical in shape. External nases, there is no discharge present. Nostril is, there is no septal deviation. While palpating, sinus area will be normal. Mouth and pharynx, lips is normal. Teeth is no aligned properly. Mouth membranes, there is no ulceration and there is no gum bleeding will be present. Tongue is normal. Buccal mucosa is normal. Odor of mouth, there is no foul smelling will be present. Throat and pharynx, tonsil is normal, uvula is normal and gag reflex is present. Neck, While inspecting neck, no enlargement of thyroid gland. While palpating, there is no tracheal deviation. Cervical lymph nodes is normal. Neck muscles movement is possible. While assessing the respiratory system, the inspection relaxed posture with a normal musculature, rate will be 18 breath per minute, presence of regular breath, there is no cyanosis. Palpation, symmetric chest expansion present, there is no lump, there is no mass and tenderness. Percussion, sound will be heard. While escalating, bronchovesicular sound will be heard, no adventitious sound, breath sound is present. While assessing cardiovascular system, inspection, there is no clubbing or cyanosis, pointed off maximal impulse normal, there is no jugular vein distension. Palpation, no palpation capillary, refilling time is less than 3 seconds. While escalating, S1 and S2 sound will be heard. Next, while assessing gastrointestinal system, inspection, skin, there is no scar, umbilicus located centrally in abdomen, pulsation is present, peristalsis is present, auscultation, there is no abnormal sound will be present, percussion, tympani present. Musculoskeletal system, there is no scar present while inspecting. Palpation, there is no tenderness and deformity. Range of motion, all active and passive range of motion in all joints are present. While assessing genitourinary system, inspection, normal in color, there is no rashes, inflammation of external genitalia. Palpation, there is no tenderness is present. Percussion, there is no dullness over. Bladder in symphysis pubis. Nervous system, all cranial nerve function is present, motor function is present, sensory function. Impression, Miss Pratiksha is diagnosed with fever for 3 days and she has temperature level will be increased, that is 100.9 degree Fahrenheit. Now Rashmika is going to continue the investigation.
Investigations are complete blood count. Red blood cells are 3.8 cells, it's normal, and white blood cells 11,800, it's slightly elevated. Platelets are 4.4 cells, and erythrocyte sedimentation rate 20 mm per hour. Serum electrolytes 133 mm, it's normal. Serum potassium 4.5 mm, and lipid profile 900 mm per deciliter. The final impression is WBC are elevated. Next, medication are discussed about soma.
This Pratiksha is under the medications of injections zonisamide 1 gram IV twice a day. It's an antibacterial drug. Injection paracetamol 1 gram IV. It's also BD and it's an antipyretic drug. Injection pantoprazole 40 mg IV BD. It's a proton pump inhibitor. Injection ondansetron 4 mg IV if it is required if needed. Anti-emetic drug. Now nursing diagnosis will be explained by Neetu.
Nursing diagnosis. Hyperthermia related to infectious process as evidenced by elevated body temperature, chillness and sweating. Deficient fluid volume related to excessive fluid loss through sweating as evidenced by dry mucous membrane, decreased urine output. Imbalanced nutrition, less than body requirements related to decreased appetite as evidenced by proper food intake, weight loss and weakness. Fatigue related to increased metabolic demand as evidenced by weakness, activity tolerance decreased. Acute confusion related to elevated body temperature as evidenced by restlessness, disorientation. Next, needs and problem continued by Sandhya D.
Education for pyrexia. First one is monitor temperature, check and record body temperature regularly, take adequate rest, ensure the sufficient rest and sleep and recovery. Drink plenty of fluid, increase intake of water, fresh juice and soups. Take medicines as prescribed. Use antipyretics, example paracetamol, only directed by the doctor. Maintain personal hygiene. Wash hands frequently and keep the body clean. Wear light clothing. Use comfortable cotton clothes and avoid excessive covering. Eat nutrition diet. Easily digestible foods such as fruits, vegetables and soups. Avoid self-medication. Do not take antibiotics or other medication without medical advice. The health education summary is maintain hydration, take adequate rest, follow prescribed treatment, monitor temperature regularly and seek medical attention if some symptoms are unprescribed. The conclusion of pyrexia is a fever is increase the body temperature above the normal range, usually due to the infection or inflammation. Early identification of the causes, proper treatment and adequate hydration, rest and regular monitoring are essential for recovery. With the medical care and nursing management, most patients recover without complication and return of normal health. Thank you.